Today, I'm not in my studio. I'm here at Dr. Sinno's office.
Hello, everyone.
So Megan Fox went on Call Her Daddy podcast and she was talking about all the surgery she did and she's gatekeeping one.
Yes.
And I want to know if you have any idea what that surgery could be.
Does the patient want to do this procedure for themselves or are they doing it for someone else?
What happens if, let's say, she's like, I want just like a nice D size, and the guy's there is like, no, make her a double D. Like,
My patient is the patient who I'm going to be operating on.
but what if he's paying? You're listening to the X Podcast. The X you keep coming back to. What's up, guys? Welcome back to the X Podcast. Today, I'm not in my studio. I'm here at Dr. Sinno's office.
Hello, everyone.
I'm so happy to have you on. This would be the second time I have a plastic surgeon on, but I feel like there's always so much to get into, and I'm so happy that you are here today.
Thank you. I'm very happy to be here too.
How long have you been a plastic surgeon for?
13 years now.
13 years.
Lucky 13.
And you still like it?
Love it.
Don't lie. Don't lie.
Love every moment. It's an amazing specialty, amazing field. You get to touch and help people every single day.
When you started, was there a specific reason why you were like, I want to be a plastic surgeon? Or
Yeah, absolutely. So I knew early on that I wanted to be a doctor. So I grew up in the Middle East, Lebanon, and there was a civil war, and I saw a lot of suffering and amputated limbs and poverty. I grew up in a lower middle income type of household, so we were very privileged compared to many others. But that sparked in me a very early empathy towards the disease, the amputated, the scarred. So I always wanted to help in that capacity, and God has given me a privilege to have a good brain where I was able to get a lot of good grades. So I had the option to go into medicine. However, I thought I was going to be a cardiac surgeon. In Lebanon, the old mentalities are, the surgeon is like the best type of doctor because they're actually doing something about. So that's the kind of limitations I was growing up with. And the cardiac surgery, cardiac, you're saving lives. The heart is so cool. Then when I got into McGill Medicine, I shadowed a few cardiac surgeons, and what they do is amazing. However, cardiology recently has taken over in many procedures, and cardiac surgery has been left for patients that are very older, where cardiology cannot help them, and the outcomes are not as good as they used to be. So in fact, it has become a very specialized niche. It's a dying field. People can get even sicker with that type of procedure. And I got bored quickly because it was like the same over and over procedure. So I decided to go and learn what other surgical specialties are out there. And the reason why I wanted surgery, besides the wanting to help immediately, is that I was very good with my hands. I'm an artist. I build stuff. And so, yes, I like to think, but I like to do as well. So I combined that with surgery and medicine. And I shadowed a few different specialties. And in the plastic surgery, the first case that I ever saw, and the second case was super cool too. The first case that I ever saw was a young man who was 17, high school, and he was doing a little bit of drugs. His girlfriend left him. He was failing school, so he decided to end his life. And he took a shotgun from his father's cabin and shot his face. So luckily, he survived this crazy ordeal. And a few months later, you could imagine that his upper part of his face is there, but his whole lower face was missing. It was like a big wound. He had no jaw, no tongue, no nose, no mid-face maxilla. And there was a group of plastic surgeons that came in, and they took his fibular bone, his muscles, his nerves, his skin.
And he reconstructed his face.
They crazily reconstructed his face, and he looked pretty good. I mean, not perfect, of course, but I was like, yes, that was my impression. Wow.
Wow.
We could do that. So I have the privilege to be able to say that I have performed successfully these types of surgeries. And that's what got me into plastic surgery.
Wow. And now you obviously form different types of surgeries. Which one did you start off doing?
Well, when you're going through medical school and residency, you start off seeing everything. So you do everything. But my first general big surgeries that I was performing were in breast reconstruction, in microsurgery. So when I went to Harvard, I learned how to do specific types of breast reconstruction after cancer. One of my big passions in life is breast cancer survivors and helping them. So I set up a system in 2 different hospitals here in Canada, at the Jewish General Hospital and the Cité de la Santé, of immediate breast reconstruction with theyve flaps. So I'm very proud to say that we've helped thousands of patients regain their feminine energy.
Wow, amazing. That's so beautiful.
Thank you.
Oh my God. I feel like as a woman, for sure, breasts are so important. Like, it's not about the size of them, but just feeling like insecure, you know, if you're going through anything, and then like, you know, just you like feeling like a woman is like super important. So that's honestly super beautiful. And then from there, you opened up your office, and then you kind of started doing what, like everything, like noses?
Yeah, so absolutely. So I do a lot of aesthetics, private plastic surgery, aesthetic surgery. I've always known that I wanted to do aesthetic surgery. It's again, passion of mine. One of my mentors, Gaston Schwartz, had taught me that reconstructive surgery is amazing because you bring the deformed back to normal. Aesthetic surgery, you're bringing the normal and enhancing the normal. So that has its own challenges. The patients are not sick, they're healthy, and they want to improve even on top of that, you know? So I love the challenge. It's an amazing type of field.
I feel like people are happier when it's not like they're enhancing, but when they've already, when they're reconstructing, because they're like, I'll take anything at this point.
Exactly. You know, as I was alluding to, the second surgery that I ever saw in plastic surgery was a construction worker who chopped off his thumb in his right dominant hand. And then the surgeons, they took his big toe and reconstructed a thumb. So,
but then he had no toe?
He had no big toe.
Oh my God. It's like, choose your battle.
Yeah, but obviously 40% of the function of the hand comes from the thumb, and the hand is quite important.
It's more important.
Imagine opening a door with just 4 fingers.
Yeah, just wear some running shoes.
Yes, exactly.
And some socks.
Yeah, so there are minimal disadvantages of having a big toe besides the aesthetic component functionally, but having a thumb is important. So you're right. His thumb didn't look like a thumb. It looked similar to a thumb, and it didn't have a full range of motion, but it had some stability. So yes, whatever you gave those patients, they were extremely gratified, satisfied.
When a patient comes in the office, how do you know when you should maybe put the brakes on doing surgery on them, because they're maybe just, you could tell they're not sure about it, versus somebody who's like, I want this, and like, you know, that regardless of what they get, the results are going to be happy because they've wanted that for a while. Absolutely.
So Alicia, it's a good question that every single plastic surgeon has to use their ethics and their medical expertise and knowing what normal proportions, symmetries are. So you have to address a few different situations. Number one, does a patient want to do this procedure for themselves, or are they doing it for someone else? And if they're doing it for someone else, this is the wrong reason.
Do they normally come with the person?
Most of the time, you're right.
Yeah.
If they are doing it for someone else, they are coming in with that person.
And like, what happens if, let's say, she's like, I want just like a nice D size, and the guy's there is like, no, make her a double D, like, and they want more for the girl than the girl does, or like that the girl says.
Yeah, so my patient is the patient who I'm going to be operating on. So she is my main priority.
Yeah.
What she wants is what I give her.
But what if he's paying?
Yeah, so he's paying, but he's not my patient.
For sure.
But when it comes to situations like that, I have to also see them a few more times, perhaps, and identify if she truly wants it.
Right.
I have refused many patients for that reason.
Oh, wow.
Where I feel like they're not doing it for the right reason.
Yeah.
You never know if that person leaves their life.
Yeah.
Then you're stuck with this permanent
for
type
sure.
of implant,
and you should
for
only
instance.
be doing something because it's something you want, or else you're going to end up regretting it, honestly. Absolutely. Regardless of whether you last with the person or not. Wow, that's crazy though. So you've rejected people who've come in.
It happens so many times. And then sometimes people come in looking amazing, beautiful, gorgeous. and they want something different. And you would have to refuse them again and say, no, your lips are fine, or your breasts are fine, or no, your eyelids are good for another 10 years.
Yeah.
You don't need this surgery. So we are living in a time in 2024 where, social media has hit us, or graced us, whatever you want to see it, for many years now, and AI is coming in, and the aesthetics and the beauty has become morphed. And so that we have to kind of, as plastic surgeons, using our ethics, help and counsel our patients to what normal is.
It's so true. Like I was telling you before, my girlfriend, she's like, I'm never doing my lips. She ended up doing them, okay? And I'm like, they look good. You did a nice size. And then the thing is that it's so easy to fall under the like, I want natural. And then you suddenly get comfortable because you're like living with these lips now. So you suddenly feel like, okay, well, these have always been my lips. So now I got to inject over because I have nothing.
Yes.
Yes. So like I could see like even through like me, you want natural, but then you lose sight a bit because you're like, it's a little bit more.
Exactly. And what is natural to you could be different naturally for someone else. And I see this a lot, whether it's lip augmentation, especially with breast augmentation. Patients always come to me, well, I shouldn't say always, most of the time come to me saying, I want natural. And then I start showing them pictures, and then you see these big, huge implants, they're round, and they're in your face. And to them, that is their natural. That's what the natural is to them. So you have to kind of cancel them and share with them, this is what natural looks like. This looks like an implant. It's fine if you want that. It's your body, your choice. But they have to kind of understand that, no, people will know that that's not natural. That is a breast implant.
That's so crazy, like dealing with the different types of people and like what they think is natural versus what you're like, oh boy, like this is not natural. Maybe it's a size F, like you can't do that.
Yes, wow, but as professionals, as you know, Alicia, this is what people come to us for a consult for. They come for our opinion, our medical opinion, and we share that with them. That's our job.
Yeah. And so I got my nose done, and I feel like it like changed my entire face. I feel like nose is one of those things where it's like, I feel like it almost like changes other parts of your features because it just like, it kind of softens your face, especially for a woman. I think for a guy, it's less needed than a girl, a nose job. What would you say?
Yeah, so absolutely. A rhinoplasty surgery, a nose job, is the surgery that can help or change a face the most. It's in the right smack middle of the face.
Yeah.
When you look at someone, generally speaking, you're looking into their eyes, the window of their soul, and the nose is right in between.
Yeah.
So if it's a very dominant nose or an asymmetric nose or irregularly shaped nose, people will see it. You can't. It's not like something you could hide, like a missing big toe, for instance. So it's definitely something that can help someone tremendously and change their look and, more importantly, their confidence within themselves, and they're able to live their life in a more the way they want.
Yeah.
So that's one of the reasons why I started doing a lot of rhinoplasties in the past 7 years. I feel like it really gives people hope and confidence.
Is your nose done?
No, my nose is not done.
Wow.
Yeah.
Got lucky.
Yes.
He's like, yes.
Yeah. God, nature has given all of us some amazing things.
Yes.
And we all have to recognize those features.
Very true.
Because if we only focus on the wrong, because none of us are perfect.
Yeah.
We all have something that we're not happy with.
Yeah.
Focus on what's nice, what's good. Yeah.
For sure.
Really.
But then you wouldn't be in business if everyone just focused on what was nice. I'm kidding.
Very true. However, we're here to help people.
Yeah.
We're not here to,
For sure.
So if people are good, then we could find another business. To
And what is a rhinoplasty go for roughly?
It depends on what you're doing. So if it's a very simple columelloplasty or a tip rhinoplasty that could be done under local anesthesia, that could be anywhere between 5 and 7K here in Canada. If it's more,
you mean just working on the bottom?
Just working on the bottom, lower third of the tip of the nose. If you're looking at a secondary or tertiary, like fixing someone else's problem,
that's when it goes up.
Yeah, you're looking at maybe above 20,000. So it's anywhere between 5 and 20,000. The average is probably around 12 to 15, depending on who's doing it and where you're doing it.
Yeah, and it's also dangerous, right? The more you keep going in and reconstructing over what was done, like it's scary.
Yes, absolutely. Any surgery, you want to get it right the first time. And that's why I'm very privileged to be in a field where the success rate is over 98%. So it's
Yeah.
generally speaking, we do a great job most of the time.
Yeah, I've seen your work, and I have to admit, you guys do a great job for sure.
Thank you.
So obviously, everyone has different types of noses. I'm Italian, so I have more of the, I think, bulge, we would say. Whereas, you know, some people have more of like the hook nose, or there's just different types of noses depending also your ethnicity. So how do you kind of do a natural nose, considering that, you know, what suits one person wouldn't suit another person?
Yes. So it's a very good question that I think every single rhinoplasty surgeon should be considering.
But they don't, because I see so many surgeons that like keep doing this huge slope. I'm like, the girl can't have the huge slope. It doesn't suit her face.
You're absolutely correct. So I do see a lot of that, fake looking noses,
Yeah.
the huge slope, upturned tip, flat columella. It just looks super fake,
Yeah.
like it's a, you know, the so-called piggy nose.
Yeah.
Or it could look like a very nice job, but it's not proper or symmetric to that face. So if it's a face with big features and you have a tiny little nose, it looks weird.
Yeah.
It's not proportionate, and
Right.
it stands out. It's like odd for when you look at it. And when you, to me, and everyone has a different definition, to me, good plastic surgery is when you cannot tell a plastic surgery was done, but the
Yeah.
person looks their best. They look amazing at it, with it. So ethnic noses are definitely different than Caucasian noses. Every different ethnicity has different special features. For instance, you were talking about yourself as being Italian.
Yeah.
So I have some Italian genes as well. I'm Mediterranean. And us Mediterraneans, we have thicker skin than, for instance, people that come from Northern Europe.
Right.
And generally speaking, we have the so-called Roman nose, which is the big dorsal hump.
Yes.
So, and we also have another feature, which is the hanging columella. So rhinoplasty surgeons that don't address or have a lot of experience with ethnic noses may remove that dorsal hump, but keep that hanging columella. I see this a lot in my original country, in
Yeah.
Lebanon. They shave off the hump, but the nose looks super long and hanging columella, and you could tell that's not a natural nose.
Right.
So you have to have experience with
Yeah.
doing ethnic noses, and we're very lucky that we live in Montreal. We have a multicultural type of
Right.
community. So most of my patients are actually ethnic nose patients, whether they come from the Middle East. Iran and Armenia are very big patient clienteles that also have very thick noses and large noses for their face. But my patients that come from Eastern Europe, for instance, they have thinner skin, and they do want some changes, and you have to take that in consideration because any small irregularity can be seen through that thin skin. However, people with thicker skin, as much of the structural work of cartilage and bony work you could do and change, if you have that big, thick wool-covered duvet, for instance, it will
Yeah.
hide that structural work. So you have to take all that into consideration,
Right.
along with their facial features.
Yeah. And I also heard, I don't know if this is a myth, but like injecting the nose is very dangerous.
So any surgical procedure can be dangerous. Any non-surgical procedure with injectables can be dangerous. Either it's done in the incorrect way or done to the wrong person, and done by the wrong person. So you want to really go to someone who knows what they're doing, who has a lot of experience.
Yeah.
For instance, I teach a lot of doctors and nurses how to do these injections. I've been doing this for 13 years, as I mentioned to you, and I go to a lot of conferences. In fact, I go worldwide giving talks about how to stay safe with these injections. So if you put a filler, for instance, when you're doing a liquid rhinoplasty, and that filler goes into a blood vessel, and that blood vessel gets occluded, which means blocked because of the filler, what oxygenation is being fed with that blood vessel is no more. And so you may end up with something called necrosis, tissue death, of that area where the blood artery was, the blood vessel was feeding. And if that goes to the retina, the eye, then you may get blindness. So the areas on the face that have the highest risk of blindness, for instance, when you talk about danger, that's the worst type of situation you want to deal with, is the glabella, so the 11 lines, frown lines. You want to avoid injecting fillers deep to that.
Okay.
Neuromodulators like Botox, Dysport, Xeomin, Letibo are okay. They don't cause that issue, but fillers can. Nose and under eyes are the second place. Can be very scary. It's very rare, but yeah, that's why you have to go to the right person doing this. And you have to go to someone who knows how to treat the complications, not just avoid them. But because if it happens, what do? You can't go to the emergency. department.
Right.
They don't treat them.
know.
They don't know. Many emergency departments don't even have Hyrondes or reversal of HA filler.
I don't know what the procedure is if you have to be licensed for it, but just going to like someone who does it in her basement, you know, it's like already it's so scary as it is. Imagine going to someone where you're just not sure like how long they've practiced for, if they really know like the complications if something goes on. Like it's just very scary.
Yes, if your provider is not talking to you about risks, then they probably don't know what they are or they're hiding it from you.
Right.
So you want to know that they are counseling you in the consultation, talking to you about all the potential risks and benefits of it and know how to treat them.
Right.
You know, it's surprising to see, I've seen this here in Canada and Montreal. So we're talking about like in third world or developing countries. Nurses coming to me being injected by people in their basements by non-nurses or medical professionals, and then they went back to their basements and that person just moved and they can go back to her. And they're left with necrosis, infections, they don't know what to do. So even a medical professional, nurse, went to someone who was not a medical professional. So we are lacking knowledge in the community, and you cannot cheapen out on your body.
I know. I was just going to say that. I think with certain things, it's better if you're going to do it to just pay what it is than to have to fix what you did after. It's going to always cost more. And you might have you're going to be dealing with like you said, complications afterwards. What is the scariest surgery that has the most risk? I always thought it was BBLs, but
in plastic surgery, I have the privilege to say that I'm one of the plastic surgeons in Quebec that did the most BBLs.
Okay, so I was going to ask you if you do BBLs.
I did many Brazilian butt lifts. I spend until 10 p.m. working on liposuction and fat grafting into the buttocks. Butt lift is probably one of the surgeries that has the highest risk when you talk about plastic surgery, aesthetic surgery. And I have the privilege to say that I'm one of the surgeons that did the most BBLs in Quebec. However, I have stopped doing BBLs. It's been almost 3 years.
Okay.
There have many reports come out, especially in Latin America, where they do the most in the world, of deaths. So if the fat was injected, just like we were talking about the filler being injected into a blood vessel, and the blood vessel gets occluded, if you inject fat into a blood vessel and in the gluteal area, in the buttocks, there's big vessels, like superior and inferior gluteal arteries, and the fat can go retrograde into the lungs. And instead of a heart attack, you get a lung attack, which we call fat emboli into the lung. And then you could stop breathing. And unlike a heart attack, it's very difficult to remove that fat from the lung.
Right.
So it can lead to death.
And so no matter how good of a surgeon you are and how good you do it, there's still a chance that afterwards throughout time that there's complications?
It's an intra-op complication. So if everything goes well in surgery and the first 24 hours pass, generally speaking, you're good.
You're good. Okay. I was curious.
Yes, no, for sure, you're right. It is surgical technique. And it's for sure, there's also some luck towards it. The arteries, the big arteries are in the gluteal muscle. They are not in the subcutaneous fat. Okay. So if you stay in that safe zone, you're good. But in a very thin patient who doesn't have much of subcutaneous fat, sometimes it could be difficult for that injection cannula to stay in the right plane. And that's where the surgical skill comes. That's why you have to choose the right surgeon.
And so you can do a BBL, but then you can also inject instead as an alternative.
Yes.
And how effective is that? Like, you're not going to get the same results?
It depends what you're looking for, but absolutely the fat grafting capability and volume is much higher.
Yeah.
If you think about just, you're doing your lip injection, you're getting 1 cc, for instance, anywhere between $400 to $800, let's say, on average. In the buttocks, you're talking about putting volumes of 1,000 cc's.
Right.
So 1,000 times 850. So we're talking about $850,000.
Right.
Of HA filler.
Yeah.
So who's going to be paying $850,000 for a 1 year result?
Right.
So it's definitely amount of volume is not what we could give. We're very lucky. There are some type of fillers that are called biostimulators that give more of almost 10 times more volume than a regular HA filler can give. But the price can still be high when you talk about how short-term the results are. even with the biostimulators, it's not 1 year, it's up to 3 years. But you're still paying a few $1,000s, up to $8,000 to get a result that will only last you 2 to 3 years.
Okay. So like technically injections in the butt, like it's more to fix like certain things. Let's say like you find, I don't know what it's called when
Hip dips.
Yeah, hip
You
dips.
got it. Yes.
It's a
Yes.
personal thing. I look at it in the mirror every time. I'm like, just fix that. Get more of like an arch. So they're called hip dips. And do a lot of people inject them?
Yes. So I do a lot of hip dip injections or cellulite.
Okay.
I do find that, generally speaking, women can be a little bit more hard on themselves than the opposite sex
Obviously.
can be on
Men
them.
could do fucking nothing and they're just like, it
And,
works.
and generally speaking, Alicia, if you have a dimple here and there, generally speaking, men won't care.
Yeah.
And if you have a hip dip, they're not looking. They're
Yeah.
not really focusing on the hip dip, and you have to fill it so that we would be with you. You know?
For sure.
So
Sure.
women are being a little bit more overly critical in some cases.
Yeah.
On their own bodies.
For sure. What's a surgery that men do most with you?
Rhinoplasty is the number one.
Yeah.
And number 2 is facelifts, and number 3 is gynecomastia, male breast tissue.
Okay. Facelifts. What like age should you be to do a facelift? Is it still like what they say, like you should only do a facelift when you're older?
Yeah.
Or-
so to me, age is just a number, unless you have medical situation because of the age. However, so I look at deformity. How much change needs to be done, and will a structural facelift help you more than a, for instance, non-surgical injectable treatment? So for me, I've even done a mini facelift on the person as early as 32 years old.
Okay.
But she really looked much older. She looked like she was 50s, in her
Okay.
50s. So a mini, small, tiny facelift, it's not a big deal. It was like a 1 hour procedure. This was around 8 years ago, before fillers were also a big thing. However, recently I am seeing a trend in the younger patient population asking me for mini facelifts, and
Yeah.
I'm seeing that more often, and it's kind of it's distressing to see that people are hypersensitive to their aesthetics
Because of
and
social media.
because of social media. Because of social
I think it's
media.
like social media, and also, we use filters. So it's like when you're so used to seeing your face through a filter, you're like, oh wait, maybe I need this, maybe,
Yes.
but it's, and also we never look as good, I feel, on video as we do in person,
Absolutely.
Like
Or
I feel
even
like
photos.
the camera adds 10 pounds,
Yes.
yeah, exactly.
Yes.
So it's hard to be a critic when you're taking videos, because sometimes I'll even be like, well, I feel like I look good, and then I'll pop my phone out and I'm like, okay, I'm so ugly, like I don't know what's happening.
Yeah, because you're missing the personality of the human that could
Yeah.
come with seeing someone live.
True, very true. So I always say women like dress for other women, when I'm like dressing and I'm like, oh, I look cute. It's not for the guy to be like, oh, you look good. A guy's gonna be like, you look good. But it's, to be in the bathroom stall and a girl to be like, wow, I love your dress. Where did you get it? Because, it feels more sincere, So I think the same thing happens a lot of times with surgery. Like sometimes we do it more. I don't know if I'm speaking on everyone, but sometimes I feel like we do it more for ourselves and other girls than we do it for men. Because I feel like men, for the most part, they're kind of like, they don't know. Or they're like, babe, you don't have to do like a crazy makeup, something natural. And then when if you'd actually show a guy what something natural is, it's like a full beat. Like men just are clueless sometimes.
Yes, generally speaking, men can be very clueless,
Yeah.
especially with the aesthetics. However, the subconscious mind will see it, whether you're a man or a woman.
True.
I'm a student of psychology, as you know. I'm also a medical doctor. So if someone looks good, and a man will not notice, oh, baby, you're blonde today. You were brunette yesterday, and you're blonde today.
Yeah.
They may not even notice it. But the subconscious mind notice, oh, babe, you look good. And they'll just move on, right? So it's the same thing when it comes to subtleties like a breast augmentation. A man will look, and with their corner of their eye, that attracts the subconscious mind.
Right.
It's the reptilian brain of ours that will see these things, not the mammalian frontal lobe that will
Yeah.
process it. Because we're thinking about, for instance, other things like a car, I'm generalizing, of course.
Yeah.
But you're right.
Wow, that's so true.
Most women will wear their Dior purse for the woman, not for the man.
It's so true. So Megan Fox went on Call Her Daddy podcast and she was talking about all the surgery she did, and she's gatekeeping one.
Yes.
And I want to know if you have any idea what that surgery could be.
Yes. So look, I did watch that video. It was a fun video to watch.
Yeah.
And I'm very proud of Megan Fox to share with everyone around her about what procedures she did.
Yeah.
Obviously, this is her own body. She has the right to disclose whatever she wants.
Do you think that celebrities need to say what they've gotten done? Like it creates like an unrealistic standard, or do you think like it's personal to each person, celebrity or not?
What, celebrity or not, I think humans should never lie. You know, honesty is key. So for someone to go and say, I never inject my lips, this is what I do, buy my product, and she becomes a billionaire later, you know, like Kylie Jenner.
Yeah.
So I'm not okay with lying about and faking it. But you don't have to mention the truth if you don't want to, you know. If someone asks you a question, you don't want to answer it, don't answer the question. Don't lie about it.
Someone comes up to you and they're like, you did your lips. How do you say it?
Thank you. That's it. You didn't confirm or not confirm?
Oh, you
Thanks,
confirmed.
you like my lips? I appreciate
confirmed though, no? I guess.
It's up to you. You can find your own way, but don't lie about it.
Yeah.
So back to Megan Fox. So she did share with us that she's done her nose, I think, once or twice, and she did her breast once or twice.
Yeah.
After her kids, before kids. But there is one surgery she was hiding.
Yes.
So when I look at Megan Fox's body before, after kids, yes, she's a little bit smaller, but she's also very small still.
Yeah.
So I don't think there's a major liposuction going on there, or a Brazilian butt lift, or any implants changes. And when we look at her face, also there's no foci or other cheek implants or fat grafting that I could perceive. Anything's possible.
Yeah.
So the procedure that can be hidden, which can and it's a deformity that can occur after pregnancy, is labiaplasty. So labia after pregnancy can become a little bit longer, swollen, and it can stay stretched. And it could be an area that people are just a little bit more hesitant to share because it is their genitals and they just don't, you know, it's private, understandably so. It is a procedure that I perform a lot, especially in spring out of, you know.
Really?
Yeah.
And how long's the recovery on that?
So basically labiaplasty, which basically it means that the labial minora, the small lips of the genitals of a female, are a little bit longer than she wants. Okay. And that sometimes could be up to the clitoral hood. And if there's too much skin, it could decrease even sensation. And not only that, the rubbing could create pain. So it's not just an aesthetic, but there's also a functional deformity that can occur. Many people don't know that. So the surgery is quite easy. It takes up to half an hour to an hour under local anesthesia. You're wide awake. You drive to us. You drive back home. And the swelling could be there usually 2 weeks. That being said, I had a woman who performs on stage. She's a professional dancer, and she strips. So she shows her genital area. And I promised her, I never promised, but I said 2 weeks, most of the swelling is gone. By 6 weeks, no one should know. And not one specific patient, she had swelling above 6 weeks. So generally speaking, it's 2 to 6 weeks. But there can be no penetration intercourse for 6 weeks minimum.
Yeah, but maybe she had swelling because she wasn't resting it. Could it be?
Anything's like, possible, you know. Anything's possible.
Like, go figure. The one patient that the swelling doesn't go away.
Anything's possible.
Okay, that's good to know. Okay. Do you think that if someone is looking into getting a breast augmentation, that they should go to a doctor that specializes in that? Like, you know, let's say for me, like when I was looking into getting my nose done, if I'm looking into getting, you know, my nose done, I'm kind of looking for a doctor that ideally specializes in it or did it enough so that I feel like comfortable. So what are your thoughts on that? Like,
absolutely. You want to go to someone who knows how to do a procedure very well, who has the appropriate training and who has the appropriate experience. And God forbid anything goes wrong, you want them to know how to fix that problem.
Yeah.
So the reason why I specialize in breast surgery, rhinoplasty, and facelift is because I love those procedures and I do so many of them. Now, of course, if a woman comes to me for a tummy tuck, that's bread and butter surgery. That's super easy for me as well. Right. So you have to go look at the patient, the doctor's experience, see the results, and see if you like those type of results.
Right.
But to say that you want to go to a rhinoplasty surgeon because they only do rhinoplasty, I mean, you can, sure. Doesn't mean that someone, for instance, like I do a lot of breast surgery, and that's how I got my name in Canada with breast surgery. I did a lot, thousands of breast reconstruction surgeries, thousands of aesthetic surgeries. But breast surgery became, there's never an easy case. But generally speaking, it became non-challenging. Like when I see a full day in my OR of breast surgery, it's an easy day.
Okay.
So I wanted a more challenge. So 7 years ago, I started doing more rhinoplasty. Now I do tons of rhinoplasty.
Right.
But for you to say, he does rhinoplasty and breast, that means he's not good at breast or rhino. That's not the truth.
Right.
I do tons of facelift. And you also want to make sure that the surgeon keeps up to date with new technology. When I decided to go to Harvard to learn face and neck lift surgery with Dr. Sumner Slavin, he taught me how to do a very good surgery with mass plication. It's just a specific technique. In the past few years, deep plane face and neck lift has become really a big deal and thing. So I did go and I'm very proud to say that I went with Dr. Nayak in St. Louis a few years ago to learn from him. He was very generous and taught me a lot of things. And so you want to go to that doctor who's keeping in touch with what's new, the trends, going to the conferences and changing his techniques or her techniques. You don't want to be doing the same technique for the past 20 years if there's something better.
Right.
If something works, for sure, keep it. But you want to be going to someone who knows what they're doing. So
Absolutely.
Yes, I don't do only face and neck lifts, although I do many of them. But I do an amazing job at them too in most of the cases. So I keep in touch, and that's what you want to be looking for. A surgeon who always keeps in touch with what the trends are to give the patients the best the techniques possible.
Right. And speaking of trends, is there a trend that kind of came in that you're like, I'm not hopping on that wagon? Was it the one? What's it?
You got it.
Yeah, I got it.
That's it. The fox eye. So I do a medical fox eye, which is basically neuromodulators, Botox, Dysport, Lutibo, just to raise the lateral brow. And that could help so many people with the droopy brow or sad look. Again, we're talking about the subconscious mind. The person's not sad, but the subconscious mind says, they're sad.
Right.
Or the corners of the lip go down, they're sad.
Right.
So that can help. And it could even push the need for an upper lid bleph, so extra skin in your upper eyelid. If you raise the brow slightly, it could relieve that pressure. And, sometimes there could be smudging of the makeup in the woman's eye. That could be improved. But for us to overly lift those brows and for the trend to go away in 2 or 3 years, which is what we're seeing now, patients are coming to reverse that trend right now. And it's very difficult to do that.
How do you do it?
It's almost impossible unless they did it with threads that are permanent. You could cut those threads, but then you're still missing skin.
But I heard threads doesn't even last long.
It depends on the threads that you're using. So in Canada, we only have one thread called the silhouette thread, which is a non-permanent type of product that's Health Canada approved. In the US, they have multiple, and Europe, they have many. And they have many that are permanent.
Okay.
But in the 90s, a lot of the permanent threads have been fraught with medical complications, like they rub through the skin, they have infections. If one thread ruptures, you have asymmetry. The one that we have here is made of a biostimulating agent, poly-LLA, and it helps the body form collagen in its stead. So it disappears within 6 weeks, and the body formed a thick collagen fiber that's pulling everything up.
Okay.
And that disappears within 2 to 3 years.
Okay. And let's talk about celebrities for a second. I know we spoke about Megan Fox, but is there a celebrity that you look at that you're just like, whoa, like the work is done so well you wouldn't even tell? And or the opposite, where you're like, this is too much.
You were talking about Megan Fox. Megan Fox has an amazing looking nose and breast. But when you're talking about older celebrities, Cher, she looks amazing for her age.
Yeah.
And maybe the younger viewers don't even know who Cher is, but she's the queen in the music industry.
Everyone's watched Burlesque. Come on.
Yeah, so she has a great plastic surgeon. Demi Moore, before her last surgery, then before her second to last surgery, looked amazing for a very long time,
Yeah.
Ashton Kutcher, was with her for a reason. She looked amazing. She's a smart, beautiful woman. But then she had a corrective surgery, her last surgery. The one before that made her look very weird. But she corrected that the weird look.
So I heard you've been watching Grey's Anatomy.
Yes, I watched a few episodes.
You can't be a doctor and just start Grey's Anatomy. What the hell? That's did you even practice?
Very true. But imagine, Alicia, that you're doing 16-hour shifts, 18-hour shifts, 24-hour shifts, 36-hour shifts in the hospital. You're living Grey's Anatomy.
Right.
For you to go home and put on the TV and watch Grey's Anatomy.
Yeah.
No, I wanted to disconnect.
For sure, which makes so much sense. But there's so much drama going on with
Yes.
like relationships and stuff. And I thought we could talk about relationships a little bit.
Yes.
What is your take on today's generation and dating? Obviously, we're living in a different day and age where like it's just nuts. It's completely nuts.
Yes, absolutely. It's completely different. It's completely nuts in many ways. Just to share with you, Alicia, that in medical school, they actually teach you how to talk to patients, whether it's how to have sex, how to have good sex, how to take care of relationships. So we do a lot of psychology. We do a lot of
Wow.
sex education as well. So, obviously I'm a human too, and I did tons of reading on this. So I would say that I'm a cool nerd, but I am a nerd. So I love reading about things. I want to perfect things, whether it's sexual or relationship-wise.
Yeah.
Watch videos. So I'm really into this. The difference now from then is, number one, the entitlement of some people has changed, and the way that you interact has changed. So now it's mostly digital. You DM someone, there's dating apps. Before you'd actually see them, you would actually go out and to a bar or a restaurant and meet
Yeah.
people. So those are the biggest changes that I am seeing.
Yeah. And what are your thoughts on like feminine versus masculine energy?
Yeah, so David Dida, who's one of my mentors when it comes to relationships, he is a psychologist in the 80s and 90s. He actually wrote a book called The Ways of the Superior Man. I highly suggest it to all your audience to read, especially men out there. And, when you talk about multi-orgasms, just for instance, men don't know that they could also have multi-orgasms. And just read that book and you'll be a multi-orgasmic man. Okay. So there are, both men and women have masculine and feminine energy. If you are a more masculine man, more manly, as we were talking before the podcast started, like the alpha, you have more masculine energy. And this could shift depending on the day, depending on the mood, depending on what you're doing. So for instance, if you're creating art, you're more in your feminine energy. If you're talking about like more logical situations, you're more in your masculine. And a woman can be more masculine and feminine. So generally speaking, the more masculine a man is, he is more attracted to the opposite, the more feminine woman.
Right.
And what we're seeing now in these days is the women have become more in their masculine because the men have become weaker in their masculine.
Right.
And that's related to multiple different situations. And I'm seeing that with my kids. They're going to a school. My son is a very masculine boy. I'm very proud of that. So he's a boy. He's very active. But in school, where they teach you how to become an automaton and a slave, they want everyone to be just small, tiny, little, quiet girls. They don't tolerate a active boy.
Right.
And they want to put them on ADHD medications.
Right.
These are the things that we're seeing from early age. As soon as the kid is in school. And we are teaching the boys to please a female teacher most of the time. Be a pleaser, be a nice guy instead of be a masculine man.
Right.
So it's education and society. Feminism kind of, I am all for women's rights. Obviously, I have a mother, I have a daughter, I have a sister, I have a beautiful partner. However, if anything to the extreme will create an imbalance, and there is definitely an imbalance in the masculine energy and feminine energy that we see in men and women. And women, if they are in their masculine energy, they are not receptive to that feminine man. They want someone more masculine than them.
Yes.
And unfortunately, our men in their society are a little bit more feminine than they should be. So if there's a big war happening here in the Western world, you would probably see them scare out and hide as opposed to go and fight and protect.
Yeah. There was a saying like men used to go to war. Now they just like heart your pictures or like something like really, really funny. And I was like, that's so freaking true.
Yeah. There's a phrase that I read in the book, and it's very true. Hard times make strong men. Strong men make good times make weak men. We're living in good times now.
Wow. That's so good. That's so good.
Yeah.
It's so true. I think to develop and be such a strong man, I feel like you need to go through some kind of like hard time to become a man.
There you go. You said it.
You need a sacrifice. You need a,
The reality is women are born with a privilege and born with a status, and men gain that status. And it's what you've done and how you've gained it that makes you that strong alpha male that's desirable for the female.
Yeah. And do you think it's the government that wants us to be like, wants men to be more like feminine?
Well, if you think about all the revolutions that happened in the world,
Yeah.
it wasn't led, generally speaking, wasn't led by a army of females. It was led by men.
Yeah.
So if you have feminized, subdued men, then they will not be standing up for the rights of the community, because
Right.
men, generally speaking, there's a lot of amazing women leaders out there, but generally speaking, men, we're born, it's in our genetics.
Yeah, it's in your nature.
It's in our nature in most
Yeah.
situations to protect and provide. In medicine, and I did 4 years of undergraduate physiology and biology, you learn about evolution. So I do believe in the Almighty God and the divine and the energy of the universe. But evolution does explain a lot of things as well. So if, for instance, and you can explain all human behavior with evolution. If you have a man who is strong, women will desire that man because they know he will protect them. We're not living in a place, generally speaking, where we need protection, but you want that security to feel
For
protected.
sure.
And a man wants peace at home. He wants to
Yeah.
come after hunting all day. Again, I'm
Yeah.
exaggerating.
Yeah.
But hunting all day to come home and have peace, relax.
Right.
He doesn't want to come home to a nagging person.
Right.
And so that's creating that disconnect. You're not getting those men that are hunting, that are fighting for
Yeah.
their family, for their well-being and protection. And you're not getting also at home that peace and protection that the men desire and need.
Right. And where do you think women fall in this? Like, because obviously, it takes two to tango. It's like we can say it's the man, but it takes two.
Yes.
So where do you think women need to kind of like adjust?
Well, it's not, like you said, it's not just about women. The woman has to not settle. That's the toughest thing, is settling. There is a biological clock in a woman that's not there in a man. So I understand why
Yeah.
a woman may want to settle because she wants to start a family. But that's also in our Western world. Maybe the woman should not be playing and having fun in her 20s. Maybe she should be more serious, because
Right.
her highest value, and the reality is a woman's value is highest when she's younger, when it comes to aesthetics and physical and biological. Now, when we're talking about mental and personality and strength, of course, she becomes more mature with age. But when you talk about, again, evolutionary speaking, a man is more desiring a female presence because of her feminine presence and her beauty and aesthetics.
Yeah.
And there's multiple psychological studies on this, so I'm not making this stuff up.
Yeah.
And vice versa, a woman wants a man who's stronger than her, smarter than her, more economically independent than her, taller than her. So she wants a man who's better than her in many ways.
Yeah.
Not every way.
I feel like we're living in a world where almost saying that is like weird. And like, I will be number one to be like, I want someone who's better than me, stronger than me, or makes more money than me. And I feel like we're living in a world where that's almost like, well, what do you mean? Like woman equality, like we're able to have like the same things. I'm like, I don't want to have the same things. It's not a competition between me and my man.
It's different. It's not the same. Yeah. That's
Yeah.
what the different. People should know that it's different. Men and women are not the same.
Yeah.
So when we say better in many parameters. However, I think there's a lot of good fathers out there, and I see myself as a good father as well, and I work on it every single day. But generally speaking, you want a woman to be better in the household and taking care of the children.
Right.
So there's
Yeah.
different qualities that a
For sure.
woman can be better at. Women could also be better in diffusing the situation than a man can.
Right.
However, a man could be better at increasing and accelerating
And thinking logically. Like, I feel like as women, we can be irrational a
Yes.
lot of times.
So to answer your question, I feel that women have to have the power to self-control. Yes, they have a lot of leverage when they're younger. Use that leverage for their benefit, and not just kind of, yes, have fun, enjoy life, and then
That's
think
amazing.
about that later.
That's great advice.
Yeah, and then men should also work on themselves to be that desired man. So,
Yeah.
like my biceps didn't just show up like that. I work
Yeah.
out since I've been 12. My degrees didn't just show up like that. I've been working on this since I can remember, maybe
Right.
8. I read multiple books on how to
Yeah.
talk to a woman, to please a woman, how to be a strong man.
Yeah.
This is things that you have to work on. Find a mentor. This is the biggest thing. Men, we've lost the cave. You know, we talk about cavemen. We go to the cave and now we have the basement. Men go to the basement and they have their boy time. But don't go play video games. Go and hang out with men that you want to emulate.
Yes.
So if you're the best person in the room, you're in the wrong room. And you are the average of the 5 people you hang out with. So seek that. I'm not saying don't leave your friends. I'm just saying find new friends as well.
Yeah.
So you learn from them different things. For instance, I have friends that are much better than me in finance. I have friends that are much stronger than me physically. I have different groups of friends that you want to emulate. That's something I would really advise men to do.
Wow, that's such good advice.
Yeah, well, this is what I teach my kids. I have 2 kids. Act like the person you want to be.
Yeah.
That's it. It's as easy as that. And your subconscious mind, your brain will get you there. And when you're talking about gratitude, and every morning you think about what you want to do in the day, and at night you think about what you did, and you're grateful for what you have, and you imagine the future. You imagine the future that already happened. And the universe, God, the brain will get you there.
Yes.
I imagine this office. I imagine these degrees, and they happen.
Yeah.
It just happens.
But could we talk about that for a second? Because I think a lot of people online talk about like the universe and how like you have to want something, you have to set it free and like let it go. I think that's where it gets a little bit tricky, because I think with manifesting, it's like, yeah, you should kind of like, you should know what you want and kind of envision that you're already going to have it. But I also think you need to work at getting it.
Why did they say let it go? Because that's the easy way of doing it.
Yeah.
Yes, manifest it, imagine it.
But
think about
manifest like you already have it as you're working towards it.
Write it down.
Yeah.
And do something about it.
Yeah.
My room's gonna be clean. My room's gonna be clean.
No, it's not.
It's not gonna be clean. You got to clean it. But you have to imagine that it's gonna be clean. You have to think about it, and then you do it.
Yeah. So same thing goes with a relationship. But I figured since we're on the topic of relationships and you're giving such good advice, I wanted to also talk about toxicity in women versus men. I feel like I was telling you before, I'm like, when I'm not in a relationship, I feel like I've like done the work, and I've done things in order to be like a better version of myself. But obviously, when you're in a relationship, there's always going to be things that, you're like, fuck, like I didn't realize I needed to work on this. Cause like a relationship, it's always compromised. The plant, if you don't water it, it dies, like truthfully. So what do you think is the reason why so many people are toxic? And what do you think they can do in order to kind of work on that?
Alicia, share with me what you mean by toxic, because toxic masculinity was a psychological term that was refuted a few years ago. Okay. But the mainstream media has used it to define toxic men for creating boundaries of what they desire. And I think every man should create boundaries when they start a relationship and continue with those boundaries, because a truly alpha female will always push the boundaries. And that's her nature.
Yes.
Subconsciously, she'll do it because she wants to test you.
So then that's not toxic. So I'm good. Beautiful.
because the woman, feminine energy, wants to test that masculine. She wants to know that, yes, I'm with that community leader or president or whatever you want to talk about, but is he still that next day? Will he still be able to protect me and my children and my household tomorrow? And the reality is, if you think about evolution, men are expendable. Yeah. Females are the ones that continue our generation. So if you think about the lion and the pride, when the lion becomes weaker, the next lion comes in, kills all the cubs, and then mates with the females. So that's why I always think about evolution. So if a female is meant to push the boundaries of the man, the man is supposed to be the rock and have those boundaries set.
But he also needs to know and be aware that like a woman does that to be able to kind of navigate that, right? If you don't, you'll be like, this girl's crazy, she's nuts, like whatever, I'm gone.
Well, it
depends, obviously.
Crazy is a big word. So I mean, if he feels that she's crazy, maybe she really is crazy.
Right.
But if she feels like she's pushing his buttons and boundaries, that's a good thing. That means she's testing him because she loves him and desires to be with him and just wants to see whether she could continue to be with him.
But don't you think a lot of times women are crazy when they're lacking kind of like that emotional support, right? I think a lot of times like men are quick to say like, oh, she's nuts, she's this, but it's like if you were really showing her the right attention, look, it's not always the case, but for the most part, I think if a girl feels secure, safe, and like you got it, I think she would be less crazy.
Absolutely.
You know?
Absolutely. There's a lot of crazy people out there.
Yeah.
A lot of people are made to be crazy because of their relationship or different
Right.
situations they're in.
Like, obviously it stems from like, your childhood traumas and everything. But I think also, when you're in a good relationship, you could kind of turn that crazy off a bit.
Yeah, absolutely.
Yeah.
Everyone. Yeah. And
Yeah.
I think that's because we're living in the good times we're talking about.
We're living in the good times.
They're creating a false sense of stress.
Yeah.
Because there's no stress. I'm so stressed. I can't live because my nose is big or I have this wrinkle and I just really need to get it fixed. Why are you hypersensitive and focused on this small little wrinkle when you have a roof on your head, on top of your head? I went through poverty in my life. You have food that you're eating three meals a day. You live in a safe country. There are a lot of people in the world now, millions of people starving. So
you always have to reverse it. Even when you're having a bad day, you have to always remember what you're grateful for in order to kind of like get through like what you're kind of, dealing with. And it's hard because you don't want to be like it's hard to like kind of tell someone, oh, well, there's like people dying or there's people who haven't had a meal. Like you can't be sad about this. It's like, yeah, you could feel sad, but I think it's okay for a little bit until you have to kind of like find your gratitude, find like what kind of, you're happy having.
Yeah. So emotions are normal human behaviors that we should feel. Feelings. So feeling sad, angry, nervous, happy are all normal human feelings. And this pursuit, I see this more often in the feminine, female type of discussions, that they always want to be happy. No, happiness is not the end goal. I actually bought a few books of how to be happy, how to have a good, happy day. This word happy is overly emphasized that this should be our goal. And when I was single and I was, figuring out women, I always probe these smart questions to feel who this person is. And like, okay, what are your goals and dreams? And, if I would say one feeling, what would you want to have? And most people would say that my ultimate goal is to be happy. No, but you can't be happy.
Isn't happy a choice?
No, because, for instance, we have a friend who just got a $1,000 ticket for speeding, right? He's not going to be happy by choice.
Right.
Yes, he's going to be grateful because he didn't have a car accident, but he's going to be upset about the ticket. It's normal. It's a human feeling. Happiness, when we talk about happiness by choice, is that you're choosing to feel happy when you could feel others' feelings because you're focusing on the grateful things that you do have. And when you talked about people feeling anxious, it's because they're focusing on what's creating that anxiety. Focus on something else.
So true. So true. And what are your thoughts on depression?
Yeah, depression is a true psychiatric disorder that can affect many people. Some people's brain wiring, they have major depressive episodes that they're constantly depressed. So it's a real phenomenon. Obviously, I feel like it's
overused now.
It's
like you have a bad day, you're like, I'm depressed. It's like
that's it. And I don't think taking pills is the right situation.
I agree.
Yeah, so obviously I went through med school here in the Western world. I didn't learn how to treat people with natural ways. I learned how to treat people with surgical ways and medicine that was funded by big pharmas to my medical school. So that's what I know. But I'm against medications when we can use natural ways. And in many cases, anxiety or depression can be treated with natural ways, whether it's living in the moment, being grateful, meditating,
going to the gym.
One time in my life, I lived through a short time of anxiety, panic attacks, depression. So this was right immediately after my divorce. I'll share with you.
Okay.
And because I'm a medical doctor, I knew the symptoms. I had anhedonia, the things I used to do. I loved. I didn't like anymore. I didn't want to talk to my friends. I would even wake up in the middle of the night with a panic attack and can't breathe. So what truly changed my feeling and behavior was my physical body, because it's all connected.
Yeah.
So your body's your temple, but it's not only the temple, it's the manifestation of the hormones that you will feel. So if you go for the run, you increase your serotonin and you're feeling good about it, you're naturally high.
Yeah.
So just by taking the steps and saying, you know what, I'm going to go and run that morning, it just made a huge change.
I could not agree more. I think a lot of times, even when I'm down and I exercise, it fully changes my mood. Like I'll hate going. And then once I'm done, I'm like, oh, like, how can you be depressed when you just banged out a workout and you just feel amazing, you know?
I'm going to give you and I'm going to give your audience a very quick neuropsychiatric hack.
Okay.
So this has been studied. There's research on it. They took a group of students, so I think it was 350, and they measured their salivary cortisol level, which is the hormone for stress, and testosterone level, which is a hormone of strength and power. People with more cortisol levels are more stressed. People with more testosterone levels are leaders, both women and men. And they asked the woman to go like this for 2 minutes, the Wonder Woman or power pose for a woman. And the man, they asked them to do the victory pose. Okay. Or they asked them to, like on the chair, just kind of sit like this, you know. And you do see some people take that stance naturally, you know, like they.
Yeah.
So do that for 2 minutes. And that's what I did just before our interview today. I do that actually in most situations where I feel like, you know what, I want to feel my best, my greatest.
Yeah.
Do that for 2 minutes, and I guarantee you have changed your neurophysiology and increased your testosterone, and you're more confident now.
Wow.
So if you have that stressful date, or if you have, you know, a podcast or an interview or whatever it is, do that for 2 minutes. I guarantee it will change you.
Wow.
Another hack.
But I don't want to look too alpha.
You will feel it. You don't have to look it. And
100%.
Another hack is for the stress and the anxiety that we were talking about is breathing. Breathing is probably the only thing that you could actually physically change in your body, just the frequency of the breathing.
Yeah.
If you breathe 8 breaths that are 8 seconds long, inhalation, exhalation, I guarantee you're going to feel so much more relaxed.
It's crazy. It's actually, I'll share a story with you, but like 2 months ago, my face just started peeling and I was like, what the hell is going on? Like my neck, my face. And I like do have a little bit of eczema, but I never had it on my face. Like it was never to this level where I was peeling, like never in my life. So I went to see a naturopath and she was like, you need to focus on your breathing, and obviously cut dairy and gluten for like a month and wait till your like cells regenerate. But she's like, breathing is so important. So I started like meditating, and the difference, like just like you don't realize, because she's like, do you breathe? I'm like, yeah, I guess. But then when you actually focus on like, hey, I have to breathe, and like you're doing like monkey breaths and you're meditating, the difference is like insane. I think it would even help with like, it helps me be less stressed, like completely.
Because it brings you back to the moment.
Yeah.
So basically, anxiety is the fear of the future. Depression is the fear or overthinking about the past.
Interesting.
And the present, if you're grateful, it really is a gift. It's a present. So you feel it.
Wow. I feel like I'm learning. You mentioned you were divorced.
Yes.
And now you have someone in your life.
Correct.
But to get that person into your life, I'm sure you went to the dating scene.
Correct.
How was that?
So it was different because I was in a relationship for a very long time. And like you said earlier in the podcast, that dating now is a little bit different.
Yeah.
So it was different. I had to kind of learn how to do it. The advantage that I had that maybe not everyone would have is that I have become the man who I want to be, and I continue to get better at it. So when you talk about the alpha and the desired man, and then if you have, the confidence, you have the physical, you have the financial, it was not very difficult for me to kind of find options. But obviously there's so many people out there that you want to find the right one for you.
Yes.
And that's where the boundaries come in. And that's where you see and feel the person out, if they have the same values that you do.
Yeah.
And how you feel with them too.
For sure. And what would you say is like some red flags you encountered with dating, where you were like, I'm going to cut this off right now because I became the man I'm supposed to be, so I can sense this and I'm out?
Yes, absolutely. So anyone who is really not good with themselves, I'm not here to fix anyone. So this is a problem that many men have. They want to fix a woman. They want to save a woman, They want to be the hero. But women are not there to be fixed or saved. They have themselves. We're there to support them how we can. And so if a woman does need to be kind of the best version of herself. I'm not there to kind of change her.
Yeah.
She needs to do that on herself. So that's
Yeah.
a red flag for men. If you feel like you need to fix someone, you're probably not with the right person.
Wow, that's great advice.
And vice versa.
Yeah, no, I ain't fixing no fucking man. Well, this was so great. Honestly, getting your advice on even relationships. I did not even know you would know this much and have read so many books and had like, wow, Victor was telling me before, he's like, you should get into, a few questions about relationships. And I was like, I don't know, like, is this off brand for like a plastic surgeon? But it's all connected and it makes so much sense. And honestly, I learned so much from this interview. Lastly, before we end this podcast, I do want to ask you, for anyone who wants to, become a plastic surgeon or a doctor,
Yes.
any advice for them?
Yeah. So when I was trying to be I was a teenager and I wanted to be a doctor, I would ask a few doctors their advice. And many people, especially in Lebanon, including my father's brother who was a doctor, don't do that. It's not a great field. There's a lot of jealousy and a lot of unhappy people. So ask the advice from people that you really trust and you value their opinion. Don't take someone else's advice to dissuade your dream or break your dream. Continue doing it, but you got to work hard. I mean, getting into medicine is probably the hardest field to get into.
Yeah.
And plastic surgery is even the hardest subspecialty or specialty to get into. So you have to be really working hard all the time until you get, and this is advice in life. Even if you don't want medicine and you want to be top, have to put in the hours. You have to fail many times to be able to succeed. You have to learn from your failures. So work hard.
Yeah. Work hard, guys, if you want to be. Well, thank you so much for coming on this episode. I truly think this is going to do so well and it's going to resonate with a lot of people. So thank you so much. I know you're a busy guy and to take, time out of your Saturday means a lot. So
thank you, Alicia.
Yeah, thank you so much.
Appreciate it. Goodbye, everyone. Thank you, everyone.
That's a wrap. This next part of the podcast is going to be me getting injected by Dr. Sinno. So if you're listening on audio, you might want to switch to YouTube now. I'm the star.
You're the host of this show. I'm the star. And you're getting injected,
You showed Alessia this, and now she's
No, it's done.
It's done.
It's done for you bitches.
The testosterone statistically increases. Okay.
Can you tell me after if I'm like eligible, like if you think I should do injection or get an implant? Because I always felt like it was never enough and I should just do an implant. For chin?
I don't know what
What's
her
under
baseline
there?
is.
Huh?
Or what her baseline is. There's 3 syringes in there.
Okay, so
Yeah.
maybe an implant would be a good way to go if you're sick of this.
Yeah.
Um,
Okay. Mm-hmm.
So the advantage of this product is that it's firm, stays for a long time, it mimics bone. The disadvantage is that people feel a little bit of pressure in the first 3 days or so, up to 2 weeks.
I think I need to move my
Wow, I didn't tear anything.
Okay. It's not that bad, huh?
No, at all. That was so easy.
Okay.
I don't feel anything, to be honest. It's great. Is this product different than the other one? Why was the other one I was tearing?
It's technique.
Oh, okay.
You most likely should say it. You will feel it after that.
Do you see a difference?
Yeah. And here with this. I don't like very pointy chins.
Me neither. Me neither.
Good. And that's the style these days.
I like you see it looks like a V, like it's scary.
Yeah, I agree. So I'm gonna just kind of shape.
Yeah. So guys, for anyone who's watching right now, I find that a chin on a woman is so important. Right? Would you agree?
On everyone.
On everyone, but a man
Yeah.
can hide it with a beard,
Absolutely.
and it's not as noticeable as like I find on a woman it really shows.
Absolutely. You're right. Men can hide it.
Yeah.
But a man, you want so
Yeah, it's nice.
Yeah, and men is the lower third of the face, which is important.
Mm-hmm.
And woman is the upper third of the face, which is
Mhm.
important. So you want a man with a big, strong jaw,
Mm-hmm.
and woman's the opposite. You want a narrow jaw.
Right.
Let's do this. So this is going to be a little bit easier. Keep breathing. 1, 2, 3. Yes. Look at you, master meditator.
Literally.
Another yet.
Wow.
Yes, loving it.
I was like, why did I cry with Victor and I didn't cry with you? He's like, technique.
No, but I didn't cry with the needle. It was more when I'm going with the cannula.
Yeah.
Oh, we opened another one.
Yeah. I don't want to give her a very pointy chin now.
No.
She has a beautiful shape of the face. I don't want to change it.
Yeah, with the needle, like that's more comfortable than the cannula.
Mm.
I prefer needle on myself.
So is it pointy? I don't think it's too pointy.
No.
Permanent implant stays for life.
Okay.
The only risks are malposition or migration movement.
Okay.
I've only seen one patient in 12 years. It's very rare.
It's right with the chin, with the jaw
Okay.
or the cheeks.
And you create the
I choose the size.
You
There's 5
choose the
sizes.
size.
Extra
Okay.
small, small, medium, large, extra large.
And what do you think you would
Intra-
use with me? Well, you don't.
Smaller, medium.
Okay.
But we'd have to revert and remove all the fillers
Yeah.
before we go.
Yeah.
And we could do it. It could be dynamic. Huh? Like you could be awake for it. It's a very easy procedure. I could freeze you, and you
Yeah.
and I could show you in the mirror, and you could tell me, yeah, I like it, not too big, whatever.
Oh wow. And how long is recovery?
Swelling, bruising up to 2 weeks.
Up to 2 weeks.
Yeah.
Okay. Not bad.
There are exceptions, like
Like our friend.
who's across the street.
That was so funny. That was the funniest thing when he said
Not
that.
funnier than the Harvard the doctor.
I have to make that a blooper.
Yeah. So Victor, if you're going to be doing this also, I'm lengthening it slightly because that was flat. And there's
Yeah,
no-
it's like for some reason it went away quickly there.
Yeah,
it'll
because you
help
had
the-
done that. I remember.
It'll help the
The double chin.
not that you do.
No, I don't have a chin to have a double.
All this is very true. Let's make it up more. Harvard. Ready?
Ready. And then.
Done. Arnica? And that should last longer than the
Yes.
first time around.
Yes.
Like how long? Like 6 months? A year?
A year. How long has it been since last time?
Maybe 6 months?
Yeah.
No?
Let me see if I can try just to hold this here.
Mhm.
You want me to take that from you?
Mhm. Guys, beauty is pain. Except this is not painful. You're like, wake up tomorrow, let me know.
Yeah, tomorrow will be like somebody punched you in the face.
Whoa. Punch.
Okay.
A light punch.
A light punch.
No, it's just pressure.
Okay.
People who are, say that this specific product has a feeling of pressure.
Okay. I'll do it.
There's no signs of any bruising.
You did a weird job at all.
No, I always had a good
Looks very
jaw.
nice.
My jaw was never the problem, it was always here.
The chin is perfect.
Yeah.
This was a dead
Oh
one.
my god, I can already tell. And I'm literally, wow. It like even emphasized my jaw.
Yeah.
I'm obsessed.
Let's over there, Victor. I'm not sure who was this.
I feel like a woman.
Look.
Oh my god, I love it.
Yeah, I love it too. It's not too pointy, it's just natural looking. We're supposed to be born with this.
The ex you keep coming back to.
Slavin, excuse me, Dr. Sumner Slavin, who's
Can we restart?
so I chose to go to Harvard.
Sorry.
Sumner, so?
The amount of times I fuck up, it's okay.
So Alicia, when I decided to go to Harvard, it's because I wanted to learn.
You're the interviewer.
I know, I'm
Seriously.
sorry. I'm sorry. Okay.
I think the word Harvard makes her
I
laugh.
just,
Yeah, Harvard. It's right there. So let it sink in.
Yeah.
Enjoy that word.
okay, you can go.
Slave man.
The slave man.
What's his name?
Oh, Slavin, Sumner Slavin.
Yeah, that's what killed me, okay? Okay.
So Alicia, she's got the laughs.
I've got the giggles, okay.
got the giggles.
Okay, go
We're gonna
say
be
that
using-
part and I won't.
Like this.
We're gonna
Okay,
be using
okay.
this for the bloopers, everyone.
Okay, sorry, go. Lights, camera, action. Okay.
So Alicia, when I decided
Yes.
to go to Harvard to learn face and neck lift surgery, it's with Dr. Sumner Slavin, and he. Seriously. Okay, I won't say his name. Clearly, we can't say it.
Shit, no, say his
I'm
name.
gonna say Boston instead of Harvard.
Okay,
too.
Okay, go say it. I'm looking down. Okay, go. Sorry.
So Alicia, when I decided to go to Harvard to learn face and neck lift